Thank you for joining us this afternoon on the program Healthy Living. I'm Adesua Osa Owagie. Tomorrow, being May 2nd, is going to be World Asthma Day. It is set aside for you and I to be more aware of the dangers of asthma. Some persons see it as just ordinary, but there are complications if you do not do the right thing. So that is why we're here today. Meanwhile, Happy Workers' Day for those of you who are observing it. Some of us don't know what it means to have a public holiday such as that. But anyway, let's just give our workers the kudos today. At least you're doing well, you're improving the economy, and of course, you're making sure that things go round. So congratulations to all workers, even whether you are self-employed or employed in one place or the other. Today we're going to look at asthma. What is asthma? How do we know that this is asthma? What are the signs and symptoms? What do we do when there's an emergency? Because I know that this particular ailment usually have loads and loads of emergency when you do not expect it. What are the risk factors? What should you run away from? These are many more we're going to be looking at today on the program. And I have with me a beautiful doctor. She's Dr. Omoage Ibifini. I hope I got that right.
Okay,
yeah.
I'm Dr. Ibifiri
Ibifiri.
Thank you.
Okay. Dr. Ibifiri, happy to have you join us today.
Thank you. Thanks for having me.
Yes, and you're as fine as your name, though. All right, doctor, quickly, what is asthma?
Okay, asthma in itself is a chronic inflammatory disease of the airway.
Okay.
I'll make it as simple as possible.
Please do.
So, now, asthma is a chronic disease, or is a chronic inflammatory disease. By that I mean it has to do with the body's immune cells, the part of the body that helps us fight infections.
Okay.
So now, normally, if you're exposed to an allergen or dust, I'll use that as an example, you may not necessarily have any form of issue with your breathing. However, those that have asthma have this over-exaggerated response of the immune system, which affects, alongside with the cells of the airway, have an interplay and then produce some chemicals that help to tighten the airway, produce a lot of mucus. And then with all these happening inside, the patient starts to complain of the symptoms that comes up. So you have chest tightness as the commonest complaint. Patients come down with, alongside cough, difficulty in breathing. So these are the major things that.
So apart from this major signs, what are other signs we should look out for?
Okay, so
because everybody will cough. Sometimes somebody will just have tightness of the chest without, knowing the cause. So what are other things we should look out for? Okay,
so first of all, asthma is like the commonest part of asthma is the allergic part. So a lot of people have these allergic symptoms. Now, you may not necessarily have an acute symptom immediately. There's some people that just, you notice that all year round, they come down with a lot of repeated kata. It's not normal. Yes. And then for some people, just little exposure to dust, they're already sneezing and having tears from the eyes. For some people, the eyes are always red, itchy. For some, it's the skin. At some seasons in the year, they have this skin rash that comes and goes very itchy. Apart from this, with the asthma symptoms, putting them together, actually you make a diagnosis both with the history and your examination findings. So there are some particular, especially with the acute symptoms. So in the somebody can just have this normal allergic symptoms as the person's normal lifestyle, and then suddenly the person is exposed to something. It can be cold, it can be a chest infection at that time. Next thing, the patient starts having the difficulty breathing, the chest tightness, wheezing. Wheezing is a major sound. Wheezing means like a whistling sound while breathing. Yes, those are the cardinal signs. So with that, you need urgent care.
Okay, so is it the same signs and symptoms we look out for in adults and in children, or is it different in children? How do we diagnose that of children anyway?
Okay, so the signs and symptoms are generally the same. However, we have other variants of asthma. We have one major one, which is common now, the cough variant asthma. So there are some people that may go into a room that has a lot of fumes or smoke, or where people are smoking, or where there's a lot of dust, and then they just start coughing uncontrollably. The cough may be productive, it may not be. But when you notice that whenever you're exposed to that particular thing, you start to cough or you start to have that difficulty breathing, it's an indication that you need to be checked. So symptom-wise in children and in adults, they are basically the same. The wheezing, especially chest tightness, difficulty in breathing, those are the cardinal signs. There's really not much difference. Except
you know that for children it's hard to tell because most of the time they don't say anything. They may not even know what is happening to them, and some parents are very careless. They would not even bother. Oh, this child have cough, go get a cough syrup or go get something for that child to use. But is there something you need to tell us parents on what to really look out for, please?
In fact, not every cough requires antibiotics. Not every cough is infective, especially when there's no fever accompanying, there's no sore throat, there's nothing else, and then this cough is not even stopping despite using cough syrups, despite using various antibiotics, and then this cough may actually be worse when the child is trying to exercise. So those are things you must look out for, especially in parents that are asthmatic. There's a tendency that the child may be asthmatic. So right from childhood, you should watch out for your child. If the child is trying to run around and then suddenly cannot breathe well, or exposed to very cold temperatures, or having this exposure to the allergens like I talked about, the cold, the dust, exercise, and the child starts to have worsening symptoms of the same difficulty in breathing and wheezing. Wheezing is one of the major sounds that you can get in children.
Is it hereditary? Because you talked about parents who are down with it to look out for their children. Is it hereditary?
Oh yes, asthma can be hereditary. In fact, you have various, we call the etiological factors, various causes. One of them is genetic. Okay. So for parents that are asthmatic, you must look out for a family history in that person. So there are genes that, for example, the ADAM33 gene, I'll just use that as an example.
ADAM33 gene, what's that?
Well, it's a gene in the body. So that's one of the genes that has been noticed to be implicated in people with asthma. And then, like I said, once somebody is asthmatic, you must look out for a family history. A lot of times there are. However, that is not the only
cause of it. So tell us other cause, doctor.
Okay, so we have 4 major broad causes. Like I said, the first one is the immunological part. There are some people that are just born that way with what we call atopy, allergy. Okay. Yes, some people are just prone. They are born that like way. That. Yes.
And nothing can be done about that.
Nothing can be done to change it. But it can be managed. Yes.
It cannot be cured.
It cannot be cured. That's just how the immune system is already. Okay. Then we have the genetic, which I talked about. Then we have environmental factors. So there are some people that work, I'll use an example, for those that are builders that are exposed to cement dust a lot. They come down with asthma because that's one of the, so we call that occupational asthma. Okay. There are some that are exposed to various other things like poultry.
Can that be cured?
Well, I will not say
occupational asthma.
For that one, you avoid that particular occupation, or you use protective equipment to help prevent those symptoms.
It cannot be cured.
For having a cure, no. But the way to treat that, avoid that particular trigger. And then most times people do very, very well, even without medications in the long run.
So asthma can only be managed, nothing like curative measures to be taken.
Now there's a last one, it's just a theory that was actually found to be true. We call it the hygiene hypothesis. It was just thought that a lot of children that are not exposed to infections in childhood, so without this exposure, there are 2 various broad cells with the immune system. So the part that normally should be triggered to fight infections is quite dormant. Okay. So in those that are not exposed, especially in white children or those that just live in very clean environments.
So it's a problem to live in a very clean environment when you're growing up. Wow, this is
that was just a
this is strange.
So for us that are more exposed to infections and all that in childhood. It's like an immune system you're building up. Yes, so to speak. So it was thought that asthma was commoner in white people in the past, but now we are seeing it among everybody. So
okay, so let's look at the treatment for asthma. What's the treatment like?
Okay, so for treatment, we have various steps we follow. Now, when a patient comes to the hospital, the first thing we do is to, of course, take a history, then now classify the patient into the various steps. Okay. Now, the mildest step, we'll ask, depending on the symptoms.
Like how many steps?
There are about 5 steps.
Okay, let's look at those steps too.
Okay, so I'll try to make it as easy as possible. For the very first step, we'll ask for the number of symptoms the person has per week.
Okay.
Number of daytime symptoms per week, and number of nighttime symptoms. So if it's less than 1, we know, okay, it may not be, sorry, per month. If it's less than 1 or 1 to 2 per month, you know that that person is not really in so much distress. Okay. So that way, the patient uses inhalers. Normally, treatment for asthma starts with inhalers. Yes, so there are various inhalers we use. At that step, we just introduce one when necessary. Okay. Now, for the next step, when we have more than 2 to 3 symptoms of daytime symptoms in a month, and then more than same number in at night, yes, we now place the patient on consistent inhalers. So yes, so we call it maintenance therapy. So you're using the inhaler, but at a low dose. Okay. Now, the next
even
step,
the inhaler have those.
Yes,
you know, like what I see, just see people bring down spray.
That's part of why we are doing this awareness. Okay. So that people will stop abusing those things. Then for the third step, of course, with worsening symptoms, we now adjust the dose accordingly and include other extra medications. Okay. Now, for the last step, which is the very critical one, at that, you know, like I mentioned, we don't have just genetic factors. So, in the what we call pathophysiology, in the whole process of how these symptoms occur, there are various steps. Okay. Yes, so at that last step, you now want to test them for those particular things, if they will respond genetically to those particular medications you want to include at the end. So, like I said, we start at a lower dose when necessary and escalate upwards as needed. For investigation, of course, before you start, you want to investigate the patient. There's something we call a peak flow meter. Okay. A peak flow meter, yes. A peak flow meter to us is just like blood pressure monitor to hypertensive patients, yes. With that peak flow meter, even before the person is in serious emergency or serious distress, you can actually tell if you're doing well or if you're getting worse with the peak flow meter. There are various parameters on it that will help you know, oh, I'm getting towards the red. So how do you
use that peak flow meter?
Okay, so the peak flow meter has various gradations. You have the red, yellow, and green. Okay. If the patient blows with all the effort, and then it's at the green, you know you're doing well. Okay. If it's at the yellow level, you know you need to adjust your medications. Okay. But when it's red, you need to be in the hospital.
Is a problem.
Yes.
Okay, is it something that one can use at home?
Perfect. Every asthmatic patient should have a peak flow meter. Okay. Every asthmatic patient should have a peak flow meter. So that's one of the things we tell people when they come to the hospital. You should have a peak flow meter.
Okay. So what are the complications?
Oh, for complications. So now one of the reasons why we normally advocate for people taking care of themselves properly, because if in childhood, some people tend to ignore these allergic symptoms. Yes. Oh, this asthma, it doesn't disturb me so much, so I don't really have to do anything. I know how to manage myself. By the time you're an adult, the airway hyperactivity that has been happening recurrently would now become permanent. So the normally in asthma is reversible. As it goes bad, it comes back to normal. But without proper management, in the long run, it becomes permanent. So
and that's dangerous.
That's dangerous. At that level, it has advanced. So the treatment is no more as easy as it should have been ab initio. Then secondly, the acute presentations. Of course, one of the major ones, sudden death. Yes. Sudden death can occur from, of course, being, when the air is tight and with a lot of mucor in it, there will be obstruction. So air cannot even pass through properly. Once air does not get to the brain, or oxygen itself, by that time, that's what I mean. When it doesn't get to the brain and other parts of the body within a stipulated time, it can lead to death. Then in the heart, it can also cause what we call arrhythmia. As the heart starts to beat irregularly, especially in that acute phase, the blood pressure can also drop.
So in that same phase.
Yes,
so the complication is quite huge.
So the complications of asthma can actually be progressive and can really be bad. Then there's what we call respiratory failure, where the airway actually shuts down. Then you need, you now need to be on ventilatory support and other things like that. So these are various complications that can arise. But like I said, the very first one we'd like to tell people about is to prevent it in adulthood from progressing to what we call COPD. It's a different form.
It's a different COPD. You take me to that unit in Okay, you know, you talked about sudden death. Before you said, I was telling myself that I was going to ask you that question, because sometimes when you watch movies, you see somebody gasp for breath, and before you know what is happening, the person is trying to reach out for the inhaler, the person dies. You know, I've seen it happen in a public vehicle. Wow. I was going somewhere, and this person was gasping for breath, and there was no inhaler around. Or, you know, of course, trust Lagosians now, everybody will just run away, you know, without really trying to attend to that person. You know, now, the question I want to ask now is this. When you don't have an inhaler, what do you do? Because most people are in the habit of either leaving the inhaler at home or just forgetting it somewhere, or because of stigmatization, they don't want to be seen with the inhaler. At least I used to have a friend those days when we were going to class, we said, they keep this inhaler for me. I said, you keep it yourself. So people will laugh at me. You know, that kind of a thing. You know, that's a different kettle of fish, because we had to do a lot of orientation and all of that. We had to involve a doctor friend of ours to like talk to, you know, like stigmatization will not allow people hold their inhaler. What else? Sometimes people will just forget, other times carelessness. So in an instance or in a situation where the patient does not have inhaler handy, what do we do? And it happens to a lot of students.
In fact, I can tell you, we lost a doctor in Delta State. With similar problems. Without the inhaler, there's really no reliever at that time.
Nothing.
At that time, once you're in the public space outside, without an inhaler, you need something to relieve that patient from that acute distress. So what we normally tell people, if you have your inhaler in your bag, if you don't have an inhaler, we also advocate, these days there are things we call nebulizers. Those nebulizers are actually machines, though they can be connected to electricity, but there are some that use batteries these days. People can actually carry them around. They are smaller ones.
Because the one I know is
quite big, yes. So there are newer models that are quite small, that you can easily use, especially for a patient that is already unconscious. You can't even tell the person, open your mouth to put in. So, because that's what we actually use in the hospital at first presentation. Now, the major thing is to prevent that from happening. You want to prevent that person from not being able to get help at that time. So, really, without the inhaler, there's really nothing much that can be done immediately, because you need something to open up the airway that is already tight. You know, you see some persons trying to... No, for the CPR.
Give the CPR.
No, for CPR, there are different reasons for CPR. Not if someone is gasping
for breath, you
don't really need to start compressing the person's chest at that time. The first thing is to take away the person from that region that has caused that first exacerbation.
Yes.
Take away the person. If it's a smoky area, take away the person from that place. If it's a cold place, if it's cold that is triggering it, you want to cover or just remove
cold can trigger heat.
Remove the person from the allergen first.
Okay.
That's the very first thing that can be done. Then there's also use of steroids, but really in the public space. So abroad, there are many things that we're even trying to advocate for here. You may have a band that you wear around for people to know that. It's just that we're still struggling with the fact that people don't want others to know that they are also
stigmatization is one huge problem that we are dealing with in the society. That's why people cannot readily come out to say, because if you do, I can assure you that before you say Jack Robinson, everybody within your vicinity is already aware. And then they have this way of looking at you and saying, this person is going to die soon. You know, that kind of a feeling.
That's very bad.
But this is the reality on the ground. This is what people do. At least the other day somebody was talking about something. I say, you know that girl we get, you know, that kind of a thing. It happens everywhere. So it's even the stigmatization that kills faster than even the ailment.
I agree with you.
So stigmatization would not allow people to do what they ought to do. So as a doctor, how do you speak to somebody who is having issues with stigmatization?
In fact, they go through a lot of counseling in the hospital. We first try to counsel them, knowing that this is not an illness that occurs in... It's not like you've done something wrong to come down with asthma. So there are many other people that have it. Even we working in the hospital come down with this asthma. So it's not something that should really make you scared or ashamed in public. Now, there are some particular jobs you may not be able to do as an asthmatic, actually, especially if your trigger, for example, people that cook with firewood, if you know you have trigger, you should not even go close. Yes, but with your medications and avoiding those triggers, you should be able to do well. So we try to tell them that it is not a death sentence. It is not something that you should say, oh, I have, and not use your medications because of that. Of course, asthma can be managed. There are many people that have been doing so well. The thing is that as they get better, we step down the medications. And even there are some people that are not even on medications at all. Yes, some are on them when necessary. So it can get better that way. The reliever has to just be around as much as possible. So the patients are encouraged to carry the inhalers.
So at no time should you forget your inhaler. Stigmatization or not, it's your health we are talking about, okay? And don't be afraid, don't be scared, just hold it, all right? Hold your inhaler, have it with you all the time. So let's quickly do the preventive measures before we leave, Doctor.
Okay, so in prevention, first of all, like I said, the very first one, avoid triggers as much as possible. We try to make sure it's individualized. Everybody will tell you, okay, you know your triggers, try and identify your triggers and avoid appropriately. Secondly, this inhaler use, some people don't even know how to use it. That's one of the major ones we've noticed. So we teach people how to use inhalers. Now these days, the companies are even making it easier. They have these codes on them that you can just, the barcodes you can just snap with your phone and then watch videos on how they're properly used.
That's fantastic.
Yes, because lack of proper use can also lead to that acute exacerbation. Then for those that just decide to stop abruptly, we encourage you, don't stop your inhalers except you're being told, okay, you're assessed, okay, I've gotten to this stage where I need to step down and say yes. Except you're advised, you don't stop. Then whenever, because infections are also part of the things that trigger. So infections, especially upper airway infections.
So you have to be very careful what you do.
Yes, as much as possible, especially like in the past few years as the COVID incident was up, we had a lot of admissions with acute exacerbation of asthma because of the COVID. So you want to protect yourself in the public space, use of face masks, then use of these vaccines. There are some vaccines you give to prevent some common infections like pneumococcal vaccine. We have influenza vaccine. Yes, we encourage those, especially the elderly people, to take them so that you don't come down with recurrent pneumonia, which can trigger an asthmatic attack. And if it's an infection causing the attack, no matter how much you use your inhalers, it will not work till you treat that infection. Yes. So that's it then. Like I said, avoid triggers, don't stop medication, and don't abuse medications because there are also complications from the medications. Yes, one of the major medications we use is steroids, prednisolone.
I get it.
People abuse that drug a lot, and then the side effects can be marked from head to toe, from hypertension to ulcers to weight gain to, in fact, a whole lot of complications. So avoid abusing medications. So those are the basic one, and above all, come to the hospital. Don't seek traditional care.
That one is very difficult for some persons because the moment you start getting some relief, hospital will be a thing of the past until there's an emergency.
So many patients have this poor health-seeking behavior and poor follow-up. So there are some that have come in emergencies, and then after taking care of them, we just lose them to follow up. And the next time the person is coming again, the person is coming in emergency again. Now that's what we really don't want. The follow-up will help to prevent these incessant admissions. With admissions, you get to spend a whole lot compared to when you would have been able to prevent. So that's just the basic thing. Otherwise, we also try to train health people working in health centers, so you don't have to really come to the major tertiary health center.
Around you at the local hospitals.
And you can still get proper care that way. So only when there are major complications, you may come to the major hospitals.
All right, doctor. Thank you so much for finding time to be with us on the program.
Thank you, because I would like to just...
Please, just say it.
Okay, thank you. I want to thank... I'm here, I'm representing I'm representing the UBTH. University of Benin Teaching Hospital will be 50 years old.
We know that. We're working together.
So these are Health Awareness Month, last month, and it continues till the event. Then I'm also here on behalf of the Medical Women Association of Nigeria, the Benin Edo State chapter, and of course my respiratory units in the Department of Medicine in UBTH. So thank you. We're working hand in hand with people, and we're really encouraging people to come to the hospital for health care.
You haven't said thank you to ITV before.
Thank you so much, ITV, for having me.
Thank you
so much.
All right, doctor. Hopefully we'll see you again, yeah?
Yes, thank you so much.
Okay, this is it for today on the program Healthy Living. I hope you have learned 1 or 2 or 3 or even 5 things from this program. Please take care of your health, okay? As your health will always be in your hands. Bye-bye.